We're here at the American Heart Association Epi and Lifestyle Sessions in Chicago. It is my pleasure to be joined by Dr. Lee, who is going to share with us some of his exciting research that he's presenting here at the conference. Dr. Lee, can you tell us a little bit about your work that you'll be sharing with the audience?
Yes, first of all, thank you for this opportunity. We're all familiar about cardiovascular health, and we also know that, that cardiovascular disease and kidney disease are closely related. So they often exist together, and then one increases the likelihood of another. So, and then the pathological processes often start at an earlier age, so that it's important to promote cardiovascular health during young adulthood to prevent these two diseases. And so we observed that in young Korean adults, having ideal levels of cardiovascular health and then improving it during young adulthood would lead to a very low risk of cardiovascular and kidney diseases combined. So and then improving it during young adulthood also result in a very low risk.
Thank you so much. What drew you to doing this work, or what inspired this project?
As I started earlier, the cardiovascular and kidney diseases are closely related, and then this the recent AHA statement also recognized this. And then the recent trials, for instance, with SGLT2 inhibitors or finerenone, they also focus on the current on the combined benefits of cardiovascular and kidney outcomes. So this kind of drove me to see whether having a good cardiovascular health has a combined benefit on both cardiovascular disease and kidney disease, which are clearly very important to prevent starting from a younger age.
Yeah, this seems really timely, particularly with that AHA statement that you mentioned, talking about cardiovascular, metabolic, and kidney disease and the overlap. So that's great. Was there anything from this study that really stood out to you as surprising or particularly exciting?
Very few young adults actually retain their good cardiovascular health at their young adulthood. So they already have a poor CVH when they reach about 40, and then about half of them stay that way, so that they have a very high cardiovascular and kidney risk. And then on the other hand, some people would improve over time, and then that was associated with a low risk of events. And also, even if you if the CVH declined over time, if you had a good CVH during young adulthood, that kind of had a extra protection even after you lost it. So I think it's important to say that that it's never too late, but then it's earlier the better to achieve cardiovascular health and maintain it throughout lifetime.
Do you see any extensions of this work to clinical practice, particularly for providers working with adolescents and young adults?
Yes, that's a good question. So we know that cardiovascular disease is very deadly, and it's important to prevent CVD. Then and kidney disease, especially CKD, is actually very common among young adults, starting with albuminuria, and it probably precedes clinical CVD in some young adults, and I think it's important to recognize, screen these kidney diseases along with other metabolic and subclinical cardiovascular diseases, and that should kind of be a motivator to promote cardiovascular health, starting from younger age and then throughout lifetime.
And we've heard some conversations already at this conference about thinking in addition to the individual level, but about systemic impacts. Are there any policy implications or opportunities for advocacy that you're thinking about related to this work?
I think the important part that we have to think about is social determinants of health, which is another layer of cardiovascular health and kidney and metabolic health. So people with disadvantages in social determinants of health are clearly at higher risk for cardiovascular and kidney diseases, and then having a higher baseline risk would mean that you actually would have a higher benefit if we promote and maintain cardiovascular health. So I think that has some implications as a population and a policy aspect.
And last question, what's next for you? Where do you see this work going forward?
So I actually presented a similar study last year related to this. So we know that it's important to attain cardiovascular health starting from young adulthood, and then it's important to keep it that way as long as possible. And that really leads to cumulative exposure or cumulative health of CVH. So I think there are also other studies in this meeting related to this, and we're also engaged in that aspect of the study. So I think it'd be exciting to have these kind of data in the future.
Thank you so much, Dr. Lee. What exciting and important work you're doing.
Thank you very much.